Manjunath Malige. I am the Chief Endocrinologist and Diabetologist at Aster Hospital, Bangalore. Today we will be talking about something called as hyperthyroidism or overactive thyroid. It is also known as thyrotoxicosis. Now this is a condition where one's thyroid gland produces thyroid hormones in excess of the requirement. It is sometimes so high that patients will have typical symptoms like losing weight gradually despite having a good appetite, feeling their own heartbeat being faster, something called as palpitations, eyes becoming quite prominent and popping out, being very irritable and angry, difficulty to sleep, and getting into petty quarrels because of loss of temper. Now in women, there are few other things that can happen. They will have real difficulty in becoming pregnant because of the excess thyroid hormones, and if they manage to become pregnant, there is a good chance of miscarriage. And if they were to keep the baby, then there is a possibility that the baby might have thyroid problems even before it is born. For these reasons, it's very important to understand what hyperthyroidism is. So as I said, this is a situation where the thyroid produces more thyroid hormones than the body ever needs. Now this usually happens due to thyroid antibodies, which are abnormal proteins that interact with your thyroid and make it go overactive. This can also happen due to presence of localized swelling within the thyroid gland, which we call as thyroid nodules. This can also happen due to excess consumption of iodine, including substances like iodized salt or anything that is rich in iodine. Now, how do we diagnose it? This can be diagnosed simply by a blood test to look for your thyroid hormone levels. Once it is diagnosed, the treatment is pretty straightforward. We have three modalities of treatment for this. One is with the tablets called antithyroid medications, which you need to take for nearly a year or a year and a half. And if the thyroid gland is enlarged, then you may be better off having a surgery to take off the thyroid gland completely, after which you will be on replacement thyroid tablets for life. The other option is to have radioactive iodine treatment, which is basically a capsule that you take, and this radioiodine kills the overactive thyroid cells. Now this again will require hypothyroidism treatment for life, but it is important to understand that if you have any of these symptoms of overactive thyroid, you see an endocrinologist and get properly assessed. Here at Aster RV Hospital, we have an excellent endocrine team with internationally qualified endocrinologists who are well versed in diagnosing and treating all hormone related conditions, including those of thyroid, pituitary, adrenal, ovaries and testes. We also have an excellent NABH accredited laboratory working 24 hours a day, and we have an excellent radiology department with top of the notch scanners, which would help us in making a precise diagnosis and providing the best endocrine care irrespective of the endocrine condition that you might have. Thank you.